Women's Health Wednesday now. February is Heart Health Month, and today we're taking a closer look at a common heart rhythm disorder known as atrial fibrillation, or AFib. Women are more at risk, and the complications can be more severe in women. Dr. Alfonso Prieto of Albany Associates in Cardiology joining us now with insight on this important topic. Doctor, thanks for coming in this morning.
You're very welcome.
Let's talk about AFib and what it really means for people. What do they experience? What is it?
Well, interestingly, some people can have no symptoms at all, which makes detection a lot harder for us. But other patients may have symptoms of palpitations, heart racing, shortness of breath, among others. But what's really difficult is that some people may have atrial fibrillation and not know they have it. With the advent of watches and monitoring devices, we're seeing a lot of people find out they have AFib where before they wouldn't have any idea they had it.
Wow.
And early detection is very important to prevent complications.
So you mean from the smart watches, and that's the way people are
Exactly. I had a friend who's a physician call me who got one of these watches 2 days ago, and he had an amount of AFib and he was completely unaware of it. So it's a very important tool for us to diagnose atrial fibrillation early.
That's terrific. Okay, so let's talk about the risk factors here and how women in particular may see some different risks.
So it's very important. We have a scoring system that assesses the risk of stroke with atrial fibrillation, which is one of the most dreaded complications.
Right.
And just by being a woman, you have a higher chance of stroke compared to a man. And that's very important because as we get older, the risk of stroke increases. And if you have other issues such as diabetes, heart failure, your risk of stroke is even higher. So women right off the bat have a higher risk of stroke. So in that case, early detection is very important to prevent that complication.
And the stroke can be more severe too.
Absolutely, more severe and sometimes with more consequences than in men. Again, with having a higher stroke risk from the beginning makes that a lot harder to treat and to diagnose.
And now women in particular, one risk factor can be age, and then there's the menopause piece to this.
So yeah, there could be a relationship with that as well, but age is definitely a factor. Age above 65, age above 75. Once you hit those ages, your risk of stroke goes up as well. So a woman over age 65 who has atrial fibrillation already is at high enough risk of stroke where we consider using blood thinners to prevent a stroke.
Okay, so family history, of course, is another one. And did you mention sleep apnea too?
Sleep apnea is a underdiagnosed condition that can be associated with atrial fibrillation. And a lot of times patients who have sleep studies, that's another place where we can pick up atrial fibrillation, where someone may be not aware they have it, but when they do this test, it comes out and we see it. So that's another way to diagnose it.
Yeah, and just the condition itself, the heart palpitations, it's uncomfortable enough, but then obviously you're really watching for those more severe complications, trying to prevent them. Let's talk about treatments, because there's something happening at one of our hospitals.
Right, so a few months ago, St. Peter's obtained a system that creates an ablation for atrial fibrillation using a different energy technology that hasn't been used before. And with this, we're able to do the ablations for atrial fibrillation much quicker, much safer, and with overall higher success rates. And from the patient perspective, it's a safer, quicker procedure with better results. So we're the only center in the Capital District and even farther out that has the system. And we've been using it for the last approximately 4 months with very, very good results.
It's at St. Peter's Hospital?
At St. Peter's, yes. Yeah.
And is Farapulse, is that correct?
Farapulse is the company that makes the system that we use right now. There's a lot of other companies making similar systems, but this one has the longest track record and the one that's available right now, and we've had very, very good results.
I know it's so important for people to speak up if they know they have some family history, right? Just speak to us a little bit about that, if you would.
Yeah, absolutely. Family history, especially in cardiology, there's a lot of genetic disorders where family history is important, and a history of sudden death or a heart attack at a young age suggests there may be a genetic component to some of these diseases. So a very important aspect when we see a patient is to see if there's any significant cardiac family history that could put you at risk for some of these complications.
All right, up to us to speak up to our doctor about it.
Absolutely.
Dr. Prieto, thank you so much for coming in, talking about this. We appreciate your time.
Sure. Anytime, anytime.
We'll have you back. For more resources and to find all of our Women's Health Wednesday segments online, you can head to news10.com, look for Women's Health under the Community tab. And make sure you stay with us because Sunday's big game is just a few days away, and we've got a live report from New Orleans coming up right after this.